So my name is Wolfgang Fendler. I'm a nuclear medicine physician and attending in the Essen University Hospital. And I would like to talk about PSMA-PET, standardized reporting, and how to use it for prognostication to predict overall survival in patients. These are findings that we have also published on the ASCO GU meeting in 2025, and that we are looking closer at the PSMA Beyond conference in Los Angeles. We have published the standardized reporting framework under the name of PROMISE in 2018. And now we've looked at a large database of patients from multiple institutions to create and analyze those standardized reports on PSMA-PET to create nomograms based on PROMISE to accurately risk stratify prostate cancer patients across all disease groups into low versus intermediate versus high risk for death, to be able to risk stratify these patients. The previous steps have been, most importantly, the introduction of PSMA-PET more than 10 years ago. Then again, 2018, we, for the first time, defined a framework on how to do a standardized reading and reporting of PSMA-PET, imaging test that is now being used throughout prostate cancer to localize disease and to determine the extent of disease. And in the summer of 2024, we have published for the first time in Lancet Oncology the first prognostic nomogram based on this imaging test, PSMA-PET, and based on standardized reporting on using PROMISE criteria, which we called PPP1. And this was based on single center data. And now we wanted to look more closely using a large multicentric data set to understand the prognostic value of PSMA-PET and to create new nomograms that we termed PPP2 as an updated version for a 3-tier risk stratification. So we collected data sets of PSMA-PET between 2014 and 2021 at 20 hospitals throughout the world, including Europe, USA, also Australia. All these patients had 3 years of overall survival follow-up and longer. And we used statistical methods to assess predictors based on PET for overall survival to build a nomogram. For this, after we built the nomogram, we used ROC analysis to compare the nomogram to clinical risk scores such as NCCN. Below, you can see those PSMA-PET metrics that are most important. This is disease extent in lymph nodes, disease extent in extrapelvic organs, and also the total tumor volume is involved in this. These are the resulting nomograms that show the prognostic value of PSMA-PET. In total, 6,000 patients have been analyzed. There were deaths reported in about 1/3 of these patients, with a median follow-up time of around 5 to 6 years. There were 2 nomograms developed that show you those findings on PSMA-PET that are independently associated with overall survival. On the visual nomogram that can be read without any software, just from the images, we see that extrapelvic lymph node metastasis on PSMA-PET, bone metastasis extent, the presence of organ metastasis, the PSMA expression score, and the total number of lesions are associated independently with overall survival. And if they are combined, they have a concordance of about more than 80% with the true overall survival to risk stratify patients. We've also developed a system using quantitative metrics. And in this system, we do not count total tumor lesions, but we do a total tumor volumetry. So the total tumor volume in liters is involved in the quantitative nomogram. Using total tumor volume and the other metrics, the other disease metrics, such as bone, organ, and lymph node involvement, this nomogram has a concordance of more than 80%, 82%, to predict overall survival in patients with prostate cancer for both low, intermediate, and high risk. And if this is compared, in the upper row, you can see the overall survival Kaplan-Meier curves using PSMA-PET nomograms, PPP2, for the overall cohort of 6,000 patients on the left side, and then for the subcohorts of initial biochemical recurrence and the different CRPC and MHSPC cohorts. And the nomogram using those metrics can stratify patients very accurately into low risk, intermediate risk, and high risk for dying. And it can do this at all disease stages from beginning to the end. When these factors are compared to the clinical nomogram, the NCCN, both compared at the same time point, at the time point of PSMA-PET, PSMA-PET nomogram has a higher accuracy of more than 82% and more than 83% in the area under the curve, as compared to NCCN, where the value is around 76% and 76%. It was a significantly higher accuracy for PSMA-PET-based risk assessment as compared to NCCN risk assessment. So we can say that PSMA-PET-based nomograms, PPP2, they accurately risk stratify patients with prostate cancer across all disease stages into low risk, intermediate risk, and high risk for overall survival. PPP2, those prostate PSMA-PET nomograms, they give us a superior accuracy when compared to the clinical standard, such as NCCN. And we have an ongoing PROMISE registry to collect more patient data, to collect a longer overall survival follow-up for potentially more accurate risk stratification using PSMA-PET in the future. And here you can see the NCT number of our registry study, but also the web page, the web presence. And with this, thank you very much for your attention. I'm looking forward to discuss and to exchange on the meeting.